As we do each week, we will begin with the Berks County COVID-19 data report. And this is also the week where Brian will give us the Co-County Wellness Update. Brian Gottschall, our Director of Berks County Department of Emergency Services. Brian?
Good morning, Commissioners. Yes, January 20th data report. Our first slide, as always, is taking a look at cases in the county, reminding everyone that as of last week, we announced we're no longer going to be able to track testing due to the methodology DOH is using to report testing now and moving negative tests into the positive column as people who were previously tested negative have subsequent tests that cause them to test positive. But our case curve has had a little bit of a tip over. I don't think that it's in any way, shape, or form adequate for us to say that we peaked and are on a downsurge. We can certainly hope that that's the case, but we also need to be cognizant of the fact that the testing operation has significantly changed, not only in Berks County, but across the state and the nation, as increasing numbers of people are using home antigen tests to diagnose their positives. Those are, of course, not reported in Pennsylvania, and that means that we could have a large number of people who are testing positive, but who aren't showing up in our data. So we need to very cautiously use this case data moving forward as we effort to understand what the significance of spread of COVID in our community is. On a nationwide level, we continue to be very red. I keep thinking that the map can't get any redder and that we're going to continue to have holdout counties with low populations. But each week we do add incrementally smaller numbers, and we can see that we're this week at 99.44% of the counties in the United States and territories that are testing at the high rate. Sorry about that. Our pediatric cases, we see what appears at face value to be very alarming spikes in numbers. But as I've said over the last couple weeks, our pediatric cases are not significantly out of line with our case count in the community. So, of course, one of the reasons we look at this is we want to understand whether kids are being disproportionately affected by COVID. And in an effort to demonstrate that, I've added this inset table here that takes a look at our COVID cases over the weekly periods back through December, and takes a look at our case counts of kids 5 to 18 and 0 to 4 as a percentage of the whole case numbers in the community. And what we see is that while we definitely have rising numbers, those numbers are not disproportionately different as a percentage of the community as a whole. So certainly some alarming slopes here, but those alarming slopes match our case slopes in the community as a whole, and that tells us that kids are being impacted in a similar way as they were when our case counts throughout the community were lower. Our hospital numbers are a little bit difficult this week. St. Joe's has some technical issues that are preventing them from updating their web portal, and as such, we can't report on St. Joe's numbers this week. So we only look at Tower Reading numbers, and what we see is that they are very similar to where they were the week prior. Again, we want to emphasize to the community that flat is not good. What we want is downward trending numbers, and these numbers still are representative of a significant impact to our healthcare community caused by COVID, both at the inpatient level here in our hospital censuses, as well as in the way that it's affecting the ingress, the EDs, the emergency rooms at our local hospitals. Again, another really bright spot for our weekly report is our influenza numbers, where we see a second week in a row of a significant downward trend in influenza in the community. So this is really great news. We hope that this is the beginning of what will be an ongoing downward slope through the remainder of the influenza season. But as we've said each week, we're all part of this solution, and we all need to be cognizant of the impact that we can have on our influenza numbers, as we're also having an appropriate impact on our COVID numbers by implementing mitigation measures and protecting ourselves. Our co-county numbers for this week show a continuing upward trend in workload coming into co-county. Again, you have to add up the numbers in this column to look at the total influx of work that they're getting. And then the colors in the columns tell us how successful they're getting, or more specifically, how much the community is cooperating with their efforts. And what we see is that even though the workload that they're getting is growing in each bi-week, we're not seeing a significant change in the amount of cooperation they're getting from the community in their case investigations, with a large number of them being unsuccessful or being successful contacts and no no follow-up then from the member of the public that they're working with. Really more of the same in the contact tracing world. The numbers are bigger, but the percentages of successful to unsuccessful in those larger numbers are really not changing in any way, shape, or form. Reminding the public that we have the COVID drive-through testing opportunity here outside of our offices. This will continue today and tomorrow from 10 a.m. till 7 p.m. and then repeat next week from Tuesday through Friday, 10 a.m. to 7 p.m. And in addition, this coming Saturday as well as next Saturday from 9 a.m. until 3 p.m. That is the end of the committed engagement by DOH to provide for testing at this location in the community. We'll, of course, keep folks updated if that changes, but as of today, we anticipate that next Saturday, the 29th, will be the end of that engagement. Reminder to folks to enter off of Van Reed Road for easiest access. And of course, directing everyone to doyourpartberks.com, where we try to keep that information as updated as possible, and where there's additional considerable resources for folks looking for information about COVID, whether it's general information, vaccines, or testing. With that, commissioners, if no questions, I'm back to you.